In this video, I'm going to be talking about discogenic low back pain and its treatment. What do we mean by discogenic low back pain? It means low back pain that is caused due to problems relating to the disc. And the disc is the intervertebral disc, which is present between subsequent vertebrae. Predominantly, the discs that are present in the lower part of the lumbar vertebrae, the lumbar vertebrae L3, L4, L4, L5 and L5S1 are the discs that are highly prone to damage and to degeneration, and they cause most of the symptoms relating to the low back. So discogenic low back pain refers to problems of the lower discs of the L3, L4, L4, L5 and L5S1 lumbar vertebrae, which they get degenerated with age. Degeneration can also be hastened by several factors. People who are absolutely sedentary and do not lead any sort of an active lifestyle are prone to premature degeneration. Dehydration is one of the most important steps that leads to degeneration. Dehydration refers to a stage where the water content in the disc keeps coming down with age. It is accelerated by people who are chronically dehydrated when they don't consume enough water and the entire body milieu itself lacks water. So proper nutrition, proper exercise and enough water are some of the critical elements very important to preserve and prevent the dehydration of the discs. When these discs become dehydrated with age or in a premature manner, they lose their elasticity and are prone to break down when they are subjected to pressure. Pressure can be of two varieties. One is a sudden intense pressure, as what happens when you suddenly fall from a height or when you lift something extremely heavy. Or it can be continuous small trauma, as what happens when somebody is traveling over a long period of time. Sitting in a vehicle and being subjected to those small vertical jerks are good enough to damage the discs. And when these discs get compressed, they tend to crack. When that elasticity is gone, a disc starts cracking up, leading to the prolapse of the internal jelly-like material, which is known as the nucleus pulposus. This nucleus pulposus protrudes through the crack in the disc and then it bulges out, and this condition is known as the herniated disc or a disc prolapse or a slip disc, as it is called colloquially. So all these are problems which happens with the disc. What happens when this sort of disc protrudes or prolapses? The part of the disc that is projecting or protruding presses on either the spinal cord. If the bulging is in the center, it presses on the spinal cord, and if the protrusion is on the sides, it presses on the emerging nerve roots, as they are called. At every gap between two vertebrae, the spinal cord gives rise to spinal nerves which innervate different parts of the body. In the case of the lower lumbar vertebrae, nerves that emerge from these intervertebral spaces are the ones that are innervating the urinary bladder, the bowels as well as the lower limbs. So when these discs protrude, they go and compress on these nerves, leading to damage or degeneration or problems relating to these nerves. It generally results in pain that is manifested along the area that the nerve innervates, that is in the regions of the leg where the specific nerve that is compressed is supplying. It can lead to sensory problems like loss of sensation or a tingling sensation or numbness and so on and so forth. It can also lead to loss of power in the muscles associated with that, and that can lead to symptoms as well. So these are the common conditions that arise from the discs that are associated with the low back. And when these symptoms are manifested, it is very easy to understand the cause of the problem as being discogenic. The test that is done to confirm this is an MRI. An MRI very clearly depicts the extent of bulge of the disc, the extent of degeneration in the disc, as well as the nerves that are affected by the disease. Thereby it is very easy to clinch the diagnosis perfectly when one has an MRI reading. Coming to the treatment of a discogenic low back pain, the conservative treatment is just to manage the pain and to allow the disease to be cleared on its own. Give administration of painkillers plus physiotherapy to relax the muscles as well as to help in the healing process is what is conventionally advised for discogenic low back pain. Many patients recover spontaneously with this conservative management. However, there is a segment of patients for whom the recovery is not proper, but the condition keeps aggravating with the passage of time. Those patients are often referred to surgical interventions. There is also a procedure of injections of steroids into the spinal canal, so that the inflammation that is associated with this discogenic problem is relieved, and that relieves pain in some cases. But in extreme situations, surgery is what is generally administered. Surgery is done by way of removing the part of the disc that is prolapsed, and in some cases it is also essential to fuse the two vertebrae so that they are not moving against each other or slipping again in their position, which can lead to further problems with the disc. So this is the common sort of condition that we encounter in discogenic chronic low back pain. However, Ayurveda has a different approach towards the treatment of discogenic low back pain. In the mild cases, Ayurvedic treatment comprises of administration of some herbal-based medicines as well as external oils and certain therapies which can help in healing the nerves and to relieve the symptoms associated with discogenic low back pain. However, there are some patients who would need intense inpatient treatment as well. They are given rest as well as treatment, and parallelly also we administer physiotherapy along with our treatments of Ayurveda. The treatments primarily comprises of certain oil massages. We have a procedure called as a Kativasti, where a medicated oil is pooled at the lower lumbar region. We also have the Panchakarma procedure called Vasti, which comprises of both herbal medicated liquids or aqueous decoctions being administered as enemas along with oil and honey and so on and so forth. Hypertonic solution is prepared as per the descriptions of the Ayurvedic classical books, and then this sort of enema is administered. This not only helps the body to detoxify itself, it also strengthens the tissues and releases the muscle spasm as well as helps the nerve to heal. We also have oil-based enemas which are called as Nehavasti. So these sort of treatments form the backbone of the Ayurvedic treatment for discogenic back pain. And this integrated treatment comprising of the medicines and the therapies plus appropriately incorporated physiotherapy. We see this to be extremely effective in our hospital when majority of the patients who are otherwise being advised for surgery because of discogenic chronic low back pain are able to completely restore to their normal function and lead normal lives without the need for surgery by undergoing this sort of a process. So this is what at AVN Arogya we offer as a comprehensive solution to discogenic low back pain. However, there is a very small percentage of patients in certain very complicated situations who may need surgery as well, and we don't hesitate to refer those patients for surgery.